In this class, we will be talking about chickenpox in pregnancy. Chickenpox is an infection of childhood. Usually, all the people uh, have had chickenpox, but some people might be spared from getting infected. So, it is a chance that when they are adult, they can have chickenpox as well. And it is worrisome if an adult is pregnant and now she develops varicella or she develops chickenpox. So this is an algorithm for diagnosis and management of varicella in the pregnancy. In PLAB1, you might see a case when a lady comes into your clinic and she says that she had been in contact with someone, she is exposed to someone who is exhibiting signs and symptoms of varicella or who has been diagnosed with chickenpox. And now she is worried and she is asking you, doctor, if I am at the risk of developing chickenpox, so what are you going to do? You are going to ask her uh, whether she was infected with chickenpox in the past. And for example, she says that, doctor, I'm not sure. I have no clue if I was infected with chickenpox. I don't remember. And in the second scenario, she might tell that, yes, doctor, I remember I was infected with chickenpox. I had chickenpox when I was a child. And she might have a well documented history from her medical notes, from her lab results, that she had chickenpox in the past, in the childhood. So then you will reassure the patient. You will say that, lady, that neither you and nor your baby is at the risk because you already have developed immunity against that disease, which means that you can never get infected again. So you will reassure and you will send the lady back. In the second case, she says that I'm not sure, so you are going to order varicella zoster IgG serology. IgG, because IgG tells us about the acquired immunity. It tells that if the patient had infection in the past. And IgM antibodies, IgM serology, tells us about the present immunity. So we will send IgG serology. And for example, the serology comes out to be positive. So what does it tell us? It tells us that the patient had varicella zoster infection or chickenpox when she was a child, maybe few years ago, but there is an evidence that she was infected. So again, we will reassure the patient. So the management is same in both this scenario, reassure and reassure. And for example, the patient serology comes out to be negative, then we will need to administer prophylaxis with varicella zoster immunoglobulin because she is pregnant. So we don't want to take the risk because she is pregnant and herself and her baby is at the risk. So this is why we will be prophylactically administering this immunoglobulin. And now we will administer it, and the patient is now, we will observe the patient, we will be observing the patient. And for example, the patient does not develop any infection, so we will reassure the patient. And for example, despite of administering this immunoglobulin, the patient has developed acute varicella. She has presented with the signs and symptoms of chickenpox, with rash, with high grade temperature, with the sense of being unwell, being sick, decreased appetite, and we are suspecting acute varicella on grounds of on clinical grounds. And there might be a case where the lady is pregnant and she has presented with rash. So we will be only looking at this part of the algorithm because now she have developed rash and we are suspecting acute varicella. And then there is no use of giving her varicella zoster immunoglobulins because she have already developed the symptom. And then all we can do is to give the antivirals to lessen the severity of chickenpox symptoms. If it is mild illness, then the oral acyclovir. If it is severe illness, then IV acyclovir. And afterwards, we will also be doing ultrasound to evaluate the baby for the signs of infection, whether the mother has transmitted infection in her baby. The fetal varicella syndrome, uh, you can be tested about it in your PLAB1 as well. The fetal varicella syndrome have limb defects, eye defects, and microcephaly. It's not very high yield, but just telling you about it, so you can tell that what happens when a newborn have varicella. Now we will move forward to this slide where I will be telling you about uh, this case when the mother develops rash, for example, right after giving birth. So, this is a little rule that is very important. It is very high yield. If the mother gave birth and after giving birth she develops rash and you're suspecting varicella, for example, on third day, so you will give varicella zoster immunoglobulin prophylaxis to the newborn, because it means that if she is presenting at this point, it means that she was infected maybe before like 2 days, 3 days, or 5 days. It means that she did not have enough chance to make immunity, make antibodies, and also transfer this to her baby. So her baby, the newborn, is not yet safe, is not yet protected. So you have to give uh, it as a prophylaxis to prevent the baby from developing any complications. So if the mother is presenting between 7 days before or after the pregnancy, then you will give varicella zoster prophylaxis. But if she presents before this time window, then you don't need to worry about it, because uh, you can only observe the child and only give the antivirals if you see the symptoms. So this is a little rule of thumb which you need to remember. So again, the newborn will receive varicella zoster prophylaxis only if the mother develops a rash less than 7 days before or after delivery, and if the rash appears more than 7 days before delivery or 7 days after delivery, the newborn will be observed for development of chickenpox and treated with acyclovir if the condition develops. So this has been taken from recent NHS guideline, and all you need to do is to have a good look at this scale, or maybe take a screenshot, and then you're good to go, and you will be performing good if any of the MCQ comes which test your knowledge of management of chickenpox in pregnancy. Thank you for watching this class.